In ICH, we're doing a Vanguard phase study in 10 centers in Canada. So patients within 48 hours after the symptoms of an acute intracerebral hemorrhage, they get randomized to either low-dose colchicine 0.5 milligrams or placebo. So the patients there followed for a median duration of 1 year. And the primary endpoint of the trial is the feasibility, of course. We want to see that within Canada, we're able to recruit patients, so the protocol, is working well. And for the main phase study that we are actively planning, the primary endpoint is going to be the rate of major adverse cardiovascular events. The reason we're doing this study is because patients after an intracerebral hemorrhage, they have a high risk of ischemic events happening. And this is happening because of increased inflammation, but also due to the recent bleed, we are withholding antithrombotic agents. So in Co-Vasc-ICH, we propose a novel approach to take the back door and use inflammation to reduce the risk of cardiovascular events in those patients. Having said that, we're going to also explore the effect of colchicine into brain function and brain inflammation. So we're going to see if there is any safety concerns about hematoma expansion and if there is any signs of efficacy in reducing disability. We did a mice model before we embarked into the study with promising results. So what if we found out in rats that we induced ICH that we gave them after colchicine is that compared to placebo, they had no increased hematoma size. And after giving the colchicine, and also there was a reduction in the prehematomal inflammation. So positive results from the animal studies, taking also into account the cardiology trials with the success of colchicine, but we need to prove whether this concept is also valid after intracerebral hemorrhage. So stay tuned.